I know many people who are either studying to be nurses or doctors or who are in the NHS, and just I feel like everybody here in some way, shape or form, even if not directly, has benefited from what, not just the NHS, but what the people in the NHS do. Day in and day out, the service that they give, they put their bodies, their mental health, their families on the line for everybody else, and it's,
Not everyone has been out on strike. What would you say to convince people to join a picket?
I think one of the key things is to recognize that the people who are on strike are basically the same as you. If you live in a country where a certain number of people hold a massive amount of wealth and everybody else just has to get by, then you know where the dividing lines are. And I think if that doesn't convince you, people have won strikes, they've won better wages, they've won better conditions, they've won the weekend, they've won workplace laws. So it shows that it works. And if it didn't work, I don't think the media would be so scared of it. I don't think certain politicians would be so scared of strikes if they didn't fear the power that strikes have to, rebalance society.
How would you respond to anyone who says NHS strikes are putting lives at risk?
I would say you only have to look at the last 13 years to see who's putting who at risk. I think it's very easy for people to try and shift the burden onto the individual, to shift the burden onto the ordinary. But, we exist in a system where MPs claim expenses on, heating their horses in their stables with the Deem Zahawi. You have a system in which there are multiple billionaires who out-earn what a nurse could make in hundreds and hundreds and hundreds of years. So that puts the NHS, that puts people's lives at risk every single day. Underfunding puts people's lives at risk every single day. The British Medical Journal did a study and they found that austerity might have caused around 100,000 excess deaths, and there's no way that that is not connected in some way, shape or form to the way that the NHS was gutted. And I think that shows you who's putting whose life at risk.
The NHS has continually changed the life of myself and everyone I know, that we don't risk poverty just from everyday illness. The NHS saved my little brother's life, and lots of people that I'm close to. My mum worked in the NHS for many years, and I think it's one of the biggest and most important parts of our society. In terms of convincing people who haven't been out on strike to join the picket, I would say it's the only effective way that we can ever get change. I would say that the people at the top of the power chain are never going to listen to us if we don't prove the force and the power that we give to this country every day without making that very real and very effectual. I would say that lives of people in this country have been put at risk by the Tories and the austerity government continually for the last 10, 12, 13 years. I would say that millions of people have died unnecessarily under this government, and that defunding the people who are working to save lives every day is what's putting lives at risk, and that will not change until we change it ourselves.
In the 1960s, the second most common reason that men went to prison in South Australia was failure to pay the family medical bill. So the NHS saved my life, saved my husband's life, it saved our son's life. I think 3 out of 5 is pretty good. And also, when someone's really sick, the immense thing of not having to think, I don't have to, it's affordable. I don't have to sell my house. I don't have to do all sorts of crazy things. That's an enormous amount of stress that's relieved off people. Austerity policies for the last 10 to 11 years have put lives at risk. A service can only deliver if it's sufficiently resourced and funded. And that's not happening. The NHS is essential. Free public health care, free access to public health care is essential to people, and people are dying, but it has to be sufficiently funded and have sufficient staff. Otherwise, what's happening, I feel, is that they're allowing it to fail, so people will turn elsewhere for health care.
Both my children were born in the NHS, so I think that you could consider that life-changing.
Paint a picture. What does Britain without the NHS look like?
A Britain without the NHS would be appalling. I don't know whether it will be as bad as Mad Max style, but I can't imagine that you would take away something that gives people so much dignity. So I think it would be appalling, and it should not be allowed to happen.
What convinced you to join the demonstration today?
It was a no-brainer. I mean, I think the NHS is remarkable. I think it needs to be saved. I think we need to be speaking out about it so that the politicians know that they can't get away with doing what they're doing.
What message do you have for politicians, Labour or Conservative, about the NHS?
Have a backbone. Put your money where it needs to be put. The money needs to be put into the NHS. I would say they're really not thinking things through. People are not striking for the fun of it. People are not losing pay for the fun of it or to put people's lives at risk. They are doing it because patients' lives are at risk already by the nature of the underfunding. So I don't think people's lives are being put at risk with the NHS strikes any more than they already are.
I just wanted to say that because you asked about personal experiences, both of my children were born here in a hospital in Homerton. My father died in a hospital in Homerton. I'm a teacher, so for me it's really important that like anyone who's working is coming together and shows solidarity, because I think there's like a real effort to divide us, to say things like that we are sabotaging children's education or that we're putting patients at risk. I think that not striking is what is putting patients at risk, and I think we need to all come together to fight for these services in education and health, childcare. And what is most frustrating is, I'm not a political person, but even like I can see there's so much profit being made at the moment, yeah? But what about the people who just work for a living? Why is that not being supported?